Cefoxitin is a semisynthetic, broad-spectrum antibiotic for parenteral administration used for the treatment of serious bacterial infections, such as urinary tract infection, blood infection, bone and joint infection, and lower respiratory tract infection. In this video, let's find found. What is cefoxitin? What is cefoxitin used for? Contraindication. What are the side effects of taking cefoxitin? How does cefoxitin work? How to use cefoxitin? What is cefoxitin? Cefoxitin is a second-generation cefamycin antibiotic developed by Merck & Company, Inc. from cefamycin C in the year following its discovery, 1972. It was synthesized in order to create an antibiotic with a broader spectrum. It is often grouped with the second-generation cephalosporins. What is cefoxitin used for? For the treatment of serious infections caused by susceptible strains microorganisms. Contraindication. A contraindication means that the drug in question should not be used under particular circumstances. For cefoxitin, this includes patients who are hypersensitive to cephalosporin antibiotics. Patients with colitis, kidney disease, or liver disease are also advised not to take cefoxitin. However, some drug databases will consider the disease's means for caution rather than contraindications. Side effects. Side effects for cefoxitin are regarded as mild. Common side effects include local tenderness or pain at the site of injection, skin color change, mild diarrhea, mild nausea, headache, loss of appetite, vaginal discharge and itching, swelling of feet or legs. While cefoxitin has not been associated with alcohol incompatibility like other members of the second-generation cephalosporins class, it has been with a higher risk of coagulopathy, a bleeding disorder. Pharmacodynamic. Cefoxitin is a cefamycin antibiotic often grouped with the second-generation cephalosporins. It is active against a broad range of gram-negative bacteria, including anaerobes. The methoxy group in the 7A position provides cefoxitin with a high degree of stability in the presence of beta-lactamases, both penicillinases and cephalosporinases, of gram-negative bacteria. Mechanism of action. The bactericidal action of cefoxitin results from inhibition of cell wall synthesis. Half-life. The half-life after an intravenous dose is 41 to 59 minutes. Dose. The dose of this medicine will be different for different patients. Uncomplicated infections. 1G4Q6-8HR, 3 to 4G/day maximum. Moderate severe infections. 1G4Q4HR or 2G4Q6-8HR, 6 to 8G/day maximum. Gas gangrene. Infections commonly requiring antibiotics in higher dosage. 2G4Q4HR or 3G4Q6HR, 12G/day maximum. Surgery prophylaxis. Prevention of infection. Colorectal, non-perforated appendectomy, hysterectomy, 1 to 2G4. Ruptured viscus, 1 to 2G4Q6HR. Safety advice. AUTGA pregnancy category B1, drugs, which have been taken by only a limited number of pregnant women and women of childbearing age, without an increase in the frequency of malformation or other direct or indirect harmful effects on the human fetus having been observed. That's all the information about cefoxitin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.